One of the things that ACP does every year is identify what our top policy issues are for the year. Not that we won't advocate on other issues as well, but we look through our hundreds of policies that we have on the books and really think through what's happening in the environment, what really matters to our members right now, where could we get some wins, all of those things. Not any one of them necessarily is more important than any other, but and so we do have a set of 9 policy priorities that we have up on our website now, and each of those has a nice one pager with it that indicates what bills or rules, regulations are relevant to it. Um, so we talked a little bit about that today in my session, but then um, and we like to use those policies as a way of really trying to be proactive in getting things done. Um, but I will say it's been more challenging this year because we have had so much to react to. We certainly knew that a new Trump administration would be disruptive. There was there was complete transparency about that. With that said, it's been probably more disruptive than I think anybody expected necessarily, including us. And so we have had this, we still are focusing on our priority areas, but we've had to also be quite reactive in a number of ways and try to, um, in terms of both uh, making statements to the public, but also outreach to our members to let them know what's going on, because we get a lot of questions from them. And then also outreach, of course, to legislators and to those in the administration. So really trying to hit all angles of what's going on in the best way we can. So some of the key issues are related now to a lot of the executive orders. So Trump released 26 on his first day in office, and I think 45 in the first couple of weeks up till the end of January. Say it's the first month, but it was really only about 11 days. And I think there are over 100 out there now. And so, and they focus on a lot of issues that our members care about. And so we have been, out sort of both publicly making statements and then also doing a lot of outreach behind the scenes to, those in Congress and others to try to see where we can make a difference. And so some of the issues are related to the, I would say, the changes on the websites that has happened in the federal government. So at the end of January 31st, it was a Friday, and I remember it well because I was getting texts and emails all over the place because members were trying to access not our website, but the federal website that they're used to accessing. So lots of databases, survey information that they use on a regular basis, whether they're in research or if they're providing direct patient care. And the pages were gone. And by that Sunday, some started to come back up. And we watched that closely. And then, of course, there was a lawsuit that Doctors for America put forward that actually led to an injunction, a temporary injunction on this, and the sites were supposed to be restored. Now, that has not happened entirely, and that's because of other EOs that interface with this, things like some of the executive orders on the definition of male and female, gender affirming care, climate change even, and forgetting one other one, but there's a number of other EOs that are really impacting the information that's available on federal websites now. So a lot of really great vaccine information that used to be up on the CDC site is gone, even though it is supposed to have been restored. And again, a lot of that has to do with sort of uncertainty around which EOs they need to comply with and how much they need to comply with them because there's so much going through the courts now. So that's one example. I think some of the others are, just some of the challenges we're facing with regard to the communications freeze from the administration. So right now, and certainly at least until Dr. Oz is confirmed, which we expect he will be, we're not hearing anything from, the Centers for Medicare and Medicaid Services, there's just a lot of uncertainty going on there. Um, but I would say one of the other things I really do want to reiterate is the concern we and our members have about the lack of the challenges, I guess, with regard to immunizations now. We have the biggest measles outbreak we've had in the country in decades, since we had a vaccine come on board. And I just spoke to one of my members today who is in Texas, lives right by where the measles outbreak is happening. And there are 2 children in their ICU who are suffering from poisoning from excess vitamin A, and they have measles. So the measles, there has been all this talk about is it castor oil, I think, that has been sent down to, that has a lot of vitamin A in it, down to Texas instead of encouraging vaccinations. And it is leading to deaths of children that are completely unnecessary. And so, I mean, red or blue states, our members are deeply concerned about that. So that's one area where we're really, really trying to continue to advocate. Hopefully can get in and actually talk with folks in the administration, once things start to settle a little bit here, and really share with them the deep concerns we have about, everyone across the country that may not be receiving their vaccinations now. Recently, a lot of the CDC grants that were given to states to help them build their public health infrastructures have been rescinded. And so the same member in Texas was talking about they had funding to put together measles tracking, and it is gone. So they're in the middle of the biggest measles outbreak that we have seen in decades. Children are dying not only from that, but also from excess toxicity from vitamin A. And they can't even track it. So, and the other thing she actually mentioned to me was even TB in correctional systems now. So it's just, and there's no way of tracking this. And so those grants and the termination of those grants is really concerning. And, and that's money that Congress had appropriated already for the agencies to use for that purpose. And so there are real legal questions around all of this. Now, I am not a lawyer, but I would say that we have engaged from ACP's side of things in judicial advocacy, largely through amicus or friend of the court briefs. So we'll provide information on our own and with a lot of other societies, sometimes to the courts, to help them understand the medical perspective. And we've done that on a lot of the state cases around reproductive health care, gender affirming care. We're also involved in some of the cases with regard to, on a totally different issue, drug price negotiation, where the pharma companies have sued the government for the drug price negotiation process. And so, again, sort of advising on medical perspective, why it's important for patients to have access to affordable medications, things like that. And, there's always, like, for instance, I mentioned Doctors for America engaging in the lawsuit around the websites, and other entities like that have never done that are doing that now. And I don't think it's necessarily off the table for us either to consider if there's something that's really going to impact our members in a significant way, which a lot of this already is. We may choose to engage in some sort of litigation as well.